Dr. Paul Gerard Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. Today I want to talk about sclerotherapy and the treatment of spider veins. We have a patient that I'm going to demonstrate on, and I want to talk about one of the new exciting FDA-approved products called the Sclera. The drug name is called polydocanol. It's a substance that came over from Europe, which has become the new standard of care for sclerotherapy. There are many treatments available for sclerotherapy, but for treatment of spider veins, but sclerotherapy with injection is the standard of care. Lasers really aren't a very good option. Surgery is still an option for deeper blood vessels and people who have vascular insufficiency and bulging veins, but for most unsightly veins that are visible on a beach, sclerotherapy still is the primary form of care. Older substances that were used, which were not as savory, were substances like salt water or sotradecol. They often carried risk of ulcerations and side effects, and most importantly, they were rather painful. So now that we have this new substance, it's a much less painful injection. The recovery is quite easy, and I'm going to show in a demonstration how it's done. Most patients need anywhere from about 2 to 4 treatments depending on the number of vessels that they have, their age, the size of the vessels. The recovery is quite easy. When they're small, they don't really require any sort of compression or aftercare. People can go right back to exercise. For patients who have larger vessels, sometimes we have them wear like a compression stocking of sort, which does help the healing process. There is a little bruising. The vessels do look a little red for a couple of days, but most people are totally healed within a week or two. We separate treatments by 2 to 4 weeks to allow the body to absorb the damaged blood vessels. These superficial blood vessels really aren't of any use to us. They're broken valves, so their removal and absorption really isn't any risk whatsoever to our body. We use a very, very small needle. I'm going to ask that we focus in a little now. You can come in closer to watch the vessel close up. And what we do is we take a little needle and we go right under the skin to get into the vessel, and you could actually, if you come up close, you could watch the substance go right into it until the vessel is gone. Now we're going to move up here. Let's move on to another vessel. And often with one treatment we could watch a whole series of vessels disappear. Right now I'm in one. Great. Shouldn't be in any pain. The needle is very small. In fact, the substance has an anesthetic effect, so most patients don't feel any discomfort whatsoever. Excellent. So here, with just a few little injections, we got a whole group of vessels. One of the other advantages of polydocanol, or a sclera, as its trade name is called, is that we can treat several different sizes. Deeper blue veins can be treated as long as they're not bulging. Sometimes we're able to do what's called foam sclerotherapy, where we mix it with air for thicker vessels. Excellent. You can see it disappear right away. Sometimes there's pinpoint bleeding, and we put some bandages on. Patients are then able to go back to their daily function. So again, sclerotherapy is still the standard of care for the treatment of spider veins. A sclera, the newer substance that's recently FDA approved, which its drug name is called polydocanol, really offers a much less painful, easier, and more effective treatment for patients who suffer from these unsightly veins. Maintenance is really not necessary, although as long as we live on the planet Earth, we will get new ones as we get older, particularly after childbirth, menopause, and other hormonal stages in life. Patients sometimes come back years later. As they get more, they get additional treatments. Please check out my website for more additional information, and hopefully I'll see you in consultation. Thank you.